What is a hymenectomy? A hymenectomy is a minor surgical procedure that involves removing part or all of a woman's hymen. It is done for a variety of reasons, most of which have to do with the malformation of the hymen. Some women have this surgery to increase comfort during intercourse, while others need it for health reasons. Why is a hymenectomy performed? A woman requiring a hymenectomy usually has an imperforate, septate, or microperforate hymen. An imperforate hymen covers the entire vaginal opening and usually has no holes or perforations. If this condition is not corrected, the menstrual blood can back up into the uterus and flow out of the fallopian tubes into the abdomen. A septate hymen typically has two small holes parallel to each other on either side of the vaginal opening. A microperforate hymen generally only has one or several very small holes. In all of these cases, a hymenectomy may be necessary to facilitate menstrual flow, make it possible to use tampons, or to facilitate sexual intercourse. In some cases, young women with relatively normal hymens also require a hymenectomy because they may have a very thick or stiff hymen, making sexual intercourse or tampon use very painful or impossible. How is a hymenectomy done? Most hymenectomy procedures are done in a matter of hours. A woman will be administered an anesthesia along with a local injection that will numb the vaginal opening. The doctor will then carefully cut away part or all of the webbing covering the vaginal opening. This may be a matter of personal preference or for religious reasons. The wounds are then stitched with a fine dissolvable suture. Post-operative details. Women usually experience a fairly fast recovery period. Mild cramping or pain is common, and ibuprofen can be taken. The patient is instructed to apply lidocaine jelly sparingly to the area for a few minutes prior to urinating and as needed for soreness. Baths are okay and in fact may provide some soothing comfort and help keep the area clean. Patients and/or parents should call your doctor at Professional Gynecological Services if they experience severe cramping, unrelieved by ibuprofen, or develops a fever. Infections and inflammation are possible, but they are relatively uncommon and usually very treatable. Make sure to schedule a post-operative office visit 1 to 2 weeks after your procedure so that the doctor can check the area for signs of inflammation or infection and make sure you are healing properly.